Feeling something unusual in your ankle, knee, hip or low back? Do you think that some maintenance work might help? When there is no injury involved, I often discover during the assessment that tight areas in certain fascia chains can stop causing the symptoms. Addressing these spots early can help alleviate the discomfort. In the posterior chain, the most important areas is to focus on the foot, outer calf muscle, outer thigh, glutes and the low back. Let me explain how to access and treat these areas. To target the foot, start by locating the area just behind the base of your outermost toe. From this point, move backwards towards the ankle by width of your fingertip. Apply pressure either using the flat surface or in your finger, the second joint of your index finger. Check if you feel any familiar symptoms or tenderness and compare the sensitivity between the symptomatic and non-symptomatic sides. Next, move to the outer calf muscle, specifically the gastrocnemius. Focus on the outermost section of the muscle belly near its lower edge. Tenderness may be present here if there is an issue present. Massage ball is a great tool for treatment. Rotate your foot outwards while applying the ball to this area. The movement helps to locate those sweet spots with ease. For the back of the thigh, concentrate on the area roughly at the midpoint of the back of your thigh. Move slightly outwards from the midline. If you need to treat this area, the massage ball is an excellent option. While applying the pressure with the ball, gently outer rotate your leg and push your pelvis forward. This technique helps you to target the right spot effectively. When working on the glutes, focus the area below the iliac crest on the side of the hip. Start by locating the gluteus medius and then follow the edge of the iliac crest backwards until you reach the gluteus maximus. These muscles overlap in gluteal region, but if you move downwards in fan-like motion, you'll stay on the track. Identify any tender spots. For treatment, place the ball against the tender area while standing, bend your knee slightly and lean against sturdy surface like cabinet for support. This makes the treatment process simple and effective. For the quadratus lumborum, locate the iliac crest and move diagonally downwards at the 45-degree angle towards the back. Tenderness is often becomes noticeable when you tuck your pelvis under by tilting it backwards. These movements makes the muscle more prominent as the muscle belly attaches the inside of the iliac crest. Compare both sides for tenderness, especially focusing on the symptomatic side. Identifying and addressing these tender is crucial for effective treatment. When treating this area, many people struggle because they forget to tilt their pelvis properly. This pelvic tilt is essential for assessing the muscle correctly, so make sure to include it in your routine. Finally, the last important area of the posterior chair is the spinal erectors, also known as long back muscles. Locate the lowest ribs along your rib cage, then move inwards towards the spine. Tender spots are often found in either side of the spinosus process. For the treatment, place the ball against the tender structure, bend your knees slightly and lean against a wall for the support. When performing these treatments, focus only on the tender structures. Play your favorite song in the background to make it enjoyable process. Treat the affected area once a day and be consistent with the maintenance, and you'll be on your way to recovery. If you have any questions, feel free to ask, and thank you for your time.